Hello everyone and welcome back to the channel. Today, we're diving into some truly groundbreaking news in the world of oncology, specifically for bladder cancer. We're talking about the EV302 trial, also known as Keynote 39.
This study is a game changer, and it could completely redefine how we treat advanced urothelial carcinoma right from the start. So, what exactly is the EV302 trial?
It's a large, global, randomized phase 3 study.
Essentially, researchers wanted to compare a new combination therapy against the long-standing gold standard, which is platinum-based chemotherapy.
The new combination consists of two powerful drugs, enfortumab, which you might know as PADCEV, and pembrolizumab, widely known as Keytruda. Let's break down these two drugs for a moment. Enfortumab, or PADCEV, is what's called an antibody-drug conjugate, or ADC.
Think of it like a smart bomb. It has an antibody part that seeks out and attaches to a specific protein called NECTIN4, which is very common on urothelial cancer cells.
Once attached, it delivers a potent chemotherapy agent directly into the cancer cell, killing it from the inside while trying to spare healthy cells.
Then you have pembrolizumab, or Keytruda.
This is an immune checkpoint inhibitor.
Our immune system has natural brakes or checkpoints to prevent it from attacking our own healthy cells.
Some cancers are clever and use these checkpoints to hide from the immune system. Keytruda works by blocking one of these checkpoints, called PD-1, which basically releases the brakes on the immune system's T cells, allowing them to recognize and attack the cancer cells.
So, the EV302 trial took patients with previously untreated, locally advanced or metastatic urothelial carcinoma and randomly assigned them to one of two groups.
One group received the combination of PADCEV and Keytruda.
The other group received the standard of care, platinum-based chemotherapy, either with gemcitabine and cisplatin, or gemcitabine and carboplatin for those who couldn't tolerate cisplatin. A really important detail about this trial is that it included a broad range of patients. It didn't matter if they were eligible for cisplatin or not, and it didn't matter what their PD-L1 status was. This makes the results incredibly relevant to a wide population of people facing this diagnosis for the first time.
The main goals of the study, or what we call the primary endpoints, were to see if the combination therapy improved two key things: overall survival, or OS, which is how long patients lived, and progression-free survival, or PFS, which is how long patients lived without their cancer getting worse. Now, let's get to the results, because they are truly spectacular. For overall survival, the median was approximately 31.5 months for patients who received the PADCEV and Keytruda combination.
Compare that to the chemotherapy group, where the median overall survival was about 16.1 months. That's almost double.
To put it another way, the risk of death for patients in the combination group was reduced by an incredible 53%. That is a massive improvement in oncology. The results for progression-free survival were just as impressive.
The median time patients lived without their cancer progressing was about 12.5 months in the combination group, versus just 6.3 months in the chemotherapy group.
This represents a 55% reduction in the risk of the cancer progressing or death. When you see numbers like this, you know you're looking at something truly significant.
But the good news doesn't stop there. The researchers also looked at response rates.
The overall response rate, which means the percentage of patients whose tumors shrank, was about 67.5% for the PADCEV and Keytruda group.
For the chemo group, it was 44.2%. Even more striking is the complete response rate. This is the percentage of patients whose cancer disappeared completely on scans. For the combination therapy, the complete response rate was nearly 30.4%.
For chemotherapy, it was around 14.5%. So, more than twice as many patients achieved a complete response with the new combination. And what's truly remarkable is the durability of these responses.
Among those patients who achieved a complete response with the combination, after about 2 years of follow-up, an estimated 95% was still alive.
This suggests that when this combination works, it can work for a very long time.
Of course, with any powerful treatment, we have to talk about safety and side effects.
The safety profile of the combination was generally consistent with what doctors already knew about each individual drug.
There were no major, unexpected safety surprises.
However, it's important to be aware of the potential side effects. The most common serious side effects, what we call grade 3 or higher, included skin reactions like a maculopapular rash, high blood sugar or hyperglycemia, low white blood cell counts or neutropenia,
peripheral sensory neuropathy, which can cause numbness or tingling in the hands and feet, diarrhea, and anemia. These are manageable for most patients, but they require careful monitoring by the medical team. So, what does all of this mean for patients? This is huge. The results of the EV302 trial are so strong that this combination of PADCEV and Keytruda has the potential to become the new first-line standard of care for people with locally advanced or metastatic urothelial carcinoma. It represents a major leap forward from traditional chemotherapy. If your loved one is facing a diagnosis of metastatic bladder cancer, these results are incredibly relevant. They demonstrate that combining an antibody-drug conjugate with an immune checkpoint inhibitor can lead to dramatically better outcomes than chemotherapy alone. It is also worth noting that some viewers might be watching this because they are actually enrolled in the EV302 protocol. If that's you, these results are directly about the treatment you are receiving, and they provide a very hopeful picture of its potential effectiveness.
For anyone in this situation, it's always crucial to discuss your specific case, your treatment history, and how these trial results apply to you with your oncology team. They can help you understand the eligibility criteria and how it all maps to your personal journey.
The success of this trial is a testament to the incredible progress being made in cancer research.
By combining two different, innovative approaches, a targeted smart bomb and an immune-boosting therapy, we are seeing outcomes that were hard to imagine just a few years ago. It's a powerful message of hope for the entire bladder cancer community.
This is a rapidly evolving field, and we will definitely be keeping a close eye on further updates from this trial and others like it. The future of bladder cancer treatment is looking brighter than ever. Thank you so much for tuning in to learn about this exciting development. If you found this video informative, please give it a thumbs up and consider subscribing for more updates on the latest in cancer research and treatment. As always, stay informed, stay hopeful,
and we'll see you in the next video.